This video I will explain best age to buy health insurance. The best age to buy health insurance is as early as possible, preferably in your 20s or early 30s. What is health insurance? Health insurance is a financial protection plan that helps to pay for medical expenses like hospital bills, surgeries, medicines, and doctor consultations. Instead of paying a large hospital bill yourself, you pay a small amount every year, and it is called a premium to an insurance company. In return, company covers your medical cost up to a certain limit. It is called sum insured. Why age matters when buying health insurance? Your age affects three important things. First one, premium cost. How much you pay every year. Second one, health risk. Your likelihood of needing medical care. Third one, waiting period completion. When your full coverage kicks in. Premium is cheaper when you are young. What is premium? Premium is the amount you pay every year to keep your insurance active. Insurance companies calculate premium based on health risk. Younger people usually have fewer medical problems, lower risk of hospitalization. So the premium is much lower. Now we will see the real life example. Rahul age is 25. Buys health insurance at the age of 25. He pays 8,000 per year for a policy. Amit age is 40. Buys same policy at age of 40. He pays 18,000 per year. Even though both policies are similar, Amit pays much more because he started later. Waiting period gets completed earlier. What is waiting period? A waiting period is the time you must wait before certain illness become covered. For example, some diseases may have a waiting period of 2 to 4 years. Now we will see the real life example. Priya buys health insurance at the age of 26. Her policy has a 3-year waiting period for certain diseases. By the time she turns 29, the waiting period is completed. Now she has a full coverage for many conditions. If she had waited until age 40, she would still have to wait until age 43 for full coverage. If you buy health insurance at the young age, you are covered before health problems starts. As people grow older, the chances of developing health problems increase. Common conditions include high blood pressure, diabetes, and heart problems. If you buy insurance after developing these conditions, they may be treated as pre-existing diseases. What is a pre-existing disease? A pre-existing disease is a health condition you already had before buying the insurance. Insurance companies usually apply long waiting periods for these conditions. Now we will see the real life example. Suresh buys insurance at the age of 45 after being diagnosed with diabetes. Because diabetes is a pre-existing disease, he must wait for 3 to 4 years before treatment for diabetes is covered. If he had purchased insurance earlier or younger age, this problem would not exist. You have to understand continuous coverage builds long-term protection. When you buy insurance early and renew it every year, you build continuous coverage. This means waiting periods finish early, coverage becomes stronger, you get more benefits over time. Now we will see best age range to buy health insurance. And here you can see the simple guidance. Age 20 to 30, it is the best time. This is the best time to buy health insurance because lowest premium, waiting periods finish early, long-term protection. Age 30 to 40, still good. Still a good time to buy insurance. However, premium will be higher and some health risk may appear. Age 40 and above, better late than never. Insurance becomes more expensive and more medical checks may be required. But it is still better to buy insurance than having no protection. Now we will see the simple real life scenario. Imagine two friends. Arjun, he buys at age 25. He pays small premiums every year and completes all waiting periods early. At the age of 40, he already has strong coverage. Vikram waits until age 40. He pays a higher premium and still needs to complete waiting periods. In this scenario, Arjun is in a much better situation. Biggest mistake many people make. Many people think, I am healthy now, I will buy insurance later. But health insurance is something you should buy before you need it, not after you become sick. So the conclusion is the best time to buy health insurance is when you are young and healthy. So you can get cheaper premiums and stronger protection later in life. Now we will see the summary. The best age to buy health insurance is early, ideally in your 20s. Premiums are lower when you are young. Waiting periods finish earlier. You avoid problems related to pre-existing diseases. Early coverage gives long-term financial protection.